You have been in an accident. You're badly hurt, bones broken, cuts bleeding all over. You're rushed to the hospital, where doctors and nurses spend hours in surgery fixing you. You're then taken to the ICU, the intensive care unit, where you hope to recover, become healthy, and then go home. But for 10% of patients, this is not the case. Their condition only worsens because of acute respiratory distress syndrome, ARDS. These patients first develop an infection of the lungs called pneumonia. And then, because they had just been through a traumatic experience, their immune system is weak. And this develops into ARDS, where sections of the lungs fill with fluid, and the patients drown from the inside. The current treatment for ARDS is to put them on a ventilator so that it breathes for them, and hopefully the body can heal itself. But there's actually a problem with this because it actually hurts the lungs. It's as if you have two balloons, one filled with water and one empty. If I blow into both balloons at the same time, all that air would go into the empty balloon. And if I blow in enough air for both balloons, that empty balloon will become overextended and damaged. Same thing happens in the lungs. All that air that the ventilator blows goes into the healthy, air-filled region of the lungs and overextends it and damages it. But this is the best treatment that we have today. And it's because of that lack of a good, targeted, effective treatment that the mortality rate for ARDS is 40%. That's 40% of people with this disease that die. But our lab is looking to change that. We want to use ultrasound and microbubbles to treat ARDS in the lungs. We inject drug-carrying microbubbles into the veins and throughout the body, then use ultrasound on the lungs to energize those bubbles and deliver drugs. It works very similarly to how you would just blow a bubble. So there, your breath gives it the energy. As you breathe in, the bubbles get bigger and bigger and bigger until they pop. Same thing with the ultrasound. The ultrasound gives energy to microbubbles and get bigger and bigger and bigger until they pop and deliver drugs specifically to that region. Now, I know what you're thinking. You want to use ultrasound in the lungs, but the lungs are filled with air, and ultrasound can't go through air. What's the point? And you'd be right. But it's that specific quality, that injured area is actually filled with fluid, allowing the ultrasound to pass through and deliver drugs only to the injured area, not the healthy region. The bubbles are popped in that specific area, and then people can get healthy. My personal research on looking at the best ultrasound settings to use for this treatment will hopefully contribute to allowing this treatment to be used in hospitals everywhere. And so if you're ever in the ICU, knock on wood, you don't have to worry about lung injury or lung disease. You can just focus on being better with ease. Thank you.